Hey everyone, this is David Ellis, and I'm here with Amy Kruzik on the Integrative Healing Network. And today, what we're going to be doing is checking out the different professions and the different professionals that people go see.
Mhm.
Often, the wrong professional for the wrong job is usually detrimental to one's health and wellness. And so, we figured that we would actually do some examination.
Yeah.
Amy, introduce yourself and let's get right into it.
Hey everyone, Amy Kruzik here. Um, so we're going to talk about the difference between a life coach. Well, you know what? I'm going to add three. I feel as though these three:
Hmm.
life coach, spiritual advisor, and counselor.
Why don't I make an addition here?
Go ahead.
Psychologist, psychotherapist, and psychiatrist as
Psychiatrist.
well.
Right.
Um, you know, here's the thing. A lot of people don't know what the difference is between these people, or they have some idea of what these people do, and sometimes it's wrong.
Yeah.
So we're going to try to parse this out and break this down in terms of scope of practice and stuff like that. So figure let's start with a life coach. If you are the kind of person who is completely disorganized, whose life is in a mess, but you don't have like psychological issues, you just can't get it together, you might want to go see a life coach.
Mm-hmm.
Because what a life coach is absolutely good for is accountability, which means that the life coach is going to tell you today you're going to wake up at 5 o'clock in the morning, you're going to go to the gym, you're going to come back from the gym, and then you're going to set up a plan on your little whiteboard. I do have a whiteboard behind me because I
Mm-hmm.
am my own life coach. And you're going to set up a plan as to how you're going to figure out your finances, figure out your life, figure out your wellness, your diet, your nutrition, and so on. That is what a life coach is good for, because a life coach will check back in with you and make sure you did it.
Mm-hmm.
And
Mm-hmm.
some people need life coaching because the operative word there is coaching. You can do it.
You can
Get to
do it.
it.
Yeah, I do like that.
Yeah, a lot of
You-
people like that because it takes
y-
a lot of this.
And I think it takes a certain personality to become a life coach.
Yeah, it does.
Yes.
Because life coaches do a lot of work. Oh my God. Okay,
Mm-hmm.
this is not going to be the kind of job if you're planning to become a life coach where you can tell somebody, well, your hour's up. I'll see you next week at 5 o'clock. No, you can't do that, right? That's not what a life coach does. A life coach is somebody who is an accountability person, also takes the time to make plans. So you got to be organized if you're a life coach, because the worst thing for a life coach is to be disorganized. Your
Yes.
clients are not going to be organized as well.
Yes. That's so true. I love that. What is it? What's the person called? Personal trainer. Same kind of thing, right?
Yeah, well, it's a coach, right? So it's a wellness coach.
Yeah.
So the wellness coach will tell you exactly how to organize your exercise routine, your diet, and your fitness as well.
Mm. Okay, so I'm gonna go to life coach and now but I think that I'm just gonna play a little scenario, but I think I need a spiritual advisor to advise me because I'm so disorganized. And I think that has something I'm just playing around.
I know.
And I think that that has something to do with my mental health.
Hmm.
I don't think a life coach can help me with my disorganization, my ADHD.
So a spiritual advisor advises you on aspects of wellness that have less to do with your corporeal or your physical body, and more less to do with your mental wellness as well, and more to do with aspects that are like spiritual, in the spiritual realm. So, as an example, a spiritual advisor can tell you that probably the relationship that you're in is not your soulmate, as an example. All right. A spiritual advisor can tell you that some of the choices that you're making will not align well. Notice the words that I'm using, align well with your life's purpose. Okay. Let's say you believe in reincarnation and you have certain gifts to offer the world, such as, I don't know, painting.
Mm-hmm.
A life coach will try to align you with those gifts and encourage you to promote those gifts and keep you on a path for maximum contentment based on your life's purpose. That's what a spiritual advisor does. A spiritual advisor does not diagnose mental issues. So if you're a spiritual advisor and you're telling people you're totally codependent and narcissistic and stuff like that, you're out of your scope of practice.
Oh, well, that's interesting.
Mm-hmm.
Huh. Okay. So, what about a counselor?
Okay, so that's a broad term, and all these people that we just mentioned are counselors to some degree.
Yeah.
But the generic form of counselor is someone who will sit down. There are different kinds of counselors. Pastoral counseling is what the priests or the pastors do. What that a counselor's job is to try to assist you with life decisions, life situations, events, and so on. Okay, what a counselor does is you present the counselor with issues that you're having, and the counselor is more of a clarifier to your mind, to your mind, to try to get the best possible outcome out of any situation. So this is what a counselor does. What a counselor does not do is diagnose mental illness based on DSM-4 and DSM-5 manuals. Okay, so that's what basically a counselor is there to do, to give you the best possible client outcome in any given situation. So as an example, a counselor can range from something like somebody who's into alcohol counseling or codependency or whatever else. The point is to get that person's life, if it's you want to use the illustration of a train, back on the tracks.
Yeah.
Yeah.
Yeah. Using CBT, cognitive behavior therapy, right?
Yes, or RBT or any of those different kinds of modalities, depending on what the counselor is trained in. Yes.
So which one would I go to for marriage counseling?
If you're going to have marriage counseling, and it depends. That's a loaded question. If you are a marriage counselor, if you want marriage counseling, you might want to go to a marriage counselor. And typically, it's the pastoral counselors that do that.
Yeah.
There are marriage counselors who are not pastoral counselors, but they can offer you insight. You wouldn't go to a drug addiction counselor.
Well, no.
Right? And you would not go to I would hope that you would not go to a psychiatrist. If you need to go to a psychiatrist for marriage counseling, then it's not going to work out, right? But
wait, what if your partner is into drug addiction?
If your partner is into drug addiction, and your partner needs to go to a drug addiction counselor,
right?
But both of y'all need to go to a marriage counselor.
So there's two separate ones then, huh?
You would have to. I would think that a drug addiction counselor is not qualified, and neither is he experienced or she experienced to do marriage counseling. But people get that all twisted. They think that one size fits all. Yeah. You might want to go to a general counselor in that case, like somebody who does not specialize to do that thing, but to deal with both of the issues if you want to go to one person. But what you don't do is go to somebody with drug addiction counseling on the wall, on their certificate or whatever the case is, and expect marriage counseling to work out very well.
No, I agree. I agree with that one.
Yeah.
So what about Psychotherapist, psychologist, and psychiatrist.
Okay, so these terms, I'm going to throw in another one, hypnotherapist. Okay,
Mm-hmm.
a hypnotherapist is someone who's trained in hypnotherapy, and that is an intervention that is used when, well, specifically, you want to get rid of a deep-seated issue very, very quickly, and you don't have enough time to spend 12 years in someone's office trying to figure it out.
Right.
Okay. The psychologist is someone who specializes in something called the talking cure. So you come and you talk it out, and the psychologist has different tools that they may employ to assist you with getting to a particular conclusion or a resolution for your issues. Okay? So a psychologist can diagnose you with some basic issues, like a psychologist can tell you definitely that you are being narcissistic.
Mm.
They can tell you that you're in a codependent relationship, etc. Very, very easily. Based on, they can also initiate based on testing. They can initiate tests like the Rorschach test, for instance. They can do a number of things that are useful to analyze your mental state and your predispositions, etc.
What is talking cure? What is talking cure?
It means that you come into my office and you sit down and you talk about it.
You just talk, and they make notes, and
they don't make notes. They also help you it's a resolution, right? And if you're going to see a psychologist, don't think that your issue is going to be resolved in one visit.
yeah,
Prepare for the long haul. Okay?
yeah.
A psychotherapist is somewhere in between the hypnotherapist and the psychologist, because a psychotherapist will utilize interventions such as CBT, REBT. I'm going to take out the acronyms. CBT is cognitive behavioral therapy. REBT is rational emotive behavioral therapy. They would use probably psychotherapy as well. Psychotherapy with the talking cure as well. They will also utilize stuff like hypnotherapy as well. All right. Neuro-linguistic programming, they utilize interventions to assist individuals because it's actually kind of like a surgery type of thing as opposed to a talking cure. Okay?
Got it. Okay.
And then there's the psychiatrist.
Yeah.
Okay. A psychiatrist deals with mental disorders. So if you have psychosis, you go see a psychiatrist. Right? If you are someone who needs to be institutionalized, a psychiatrist is the person that will do that. The difference between a psychiatrist and all the others is that a psychiatrist is a medical doctor who can use medical interventions, such as drugs, such as Prozac, Epilim, all of those drugs, to help individuals or clients achieve some sort of lifestyle or quality of life despite mental disorders. Okay?
Do psychiatrists need a psychologist to tell them that this person actually needs more help than I can give them? Don't they work together?
In terms of referral, yeah, theoretically, well, no, not necessarily. I'll tell you why. Because the cases that come into a psychiatrist is not the kind of case that would come into a psychiatrist is not the kind of case that would be something that would happen inside a psychiatrist or a psychotherapist office.
Well, I just wondered because you don't know if you have something going on until you do talk to someone. And so the psychiatrist would then be able to help you with balancing your brain with medication.
Okay, yeah, there is that. I think a lot of people who are suffering from mental illnesses, they generally tend to go to a psychotherapist first, and the psychotherapist will refer them.
Mm-hmm.
Okay? Because a psychiatrist will have manual, DSM-5, I think we're at right now, with a host of different psychological disorders that they can apply a diagnosis to and suggest and prescribe medication. A psychotherapist cannot prescribe medication, neither can a psychologist prescribe medication. Okay? If you are at the stage where you need medication, then a psychiatrist is the person that you need to see. Okay. Yes, they usually get references from psychotherapists, hypnotherapists, psychologists, and counselors.
Okay, so let me just ask you, I'm going to throw this in because just an experience, not I had, but someone else. So general practitioners can prescribe
Mm-hmm.
drugs for the
Correct.
mind. Now,
Yeah.
see, because you come in with these specific complaints, they're going to say, try these, what do they call them? Like serotonin?
You mean depressants and
Yeah.
antidepressants? Yeah.
Yeah.
Okay. So this is a problem that has been pervasive, because I'm going to tell you right now, a general practitioner, a medical doctor, a general practitioner is not qualified to make psychiatric diagnosis. It's out of their scope of practice. So them prescribing, let's say, a drug for something or the other is very interesting. Yeah.
It is, because I just want people to know that, like, just because you go to your doctor and say you have these symptoms, I'm in bed all day, or those depressive symptoms, I would not. I would totally go to a psychiatrist, psychologist somewhere.
Yeah, I honestly think that a lot of people, we're overprescribed with regard to the antidepressants and all those things in our society, and antidepressant drugs, right? People are writing prescriptions for Prozac and all that stuff.
Yeah.
Like, it's like, whatever.
Candy.
This is unprecedented in our times. I think that has a lot to do with pharmaceutical companies dumbing down certain dosages so that it can be prescribed without consequence, so to speak. I think that a lot of people are heavily dependent on antidepressants.
Mm-hmm. And
a lot of people don't want to do the work, because if I could just take a pill,
right,
we're good.
we're good. And so what was I going to say there? Darn. What happens is these drugs take a while for them to work, right?
Yes.
Where the psychiatrist knows we're going to start you low. I mean, I'm sure the doctor may start you low, but it's like they need to keep track of you. Like, I don't know.
Yes.
I don't know. And then you can't just quit like that. Like, oh, I feel good, I'm going to go. You can't just stop them.
Correct. You can't just stop them. Let's say
No.
you're on Cipralax as an example, and you decide one day, oh, I could just simply stop Cipralax. No, you can't. You absolutely can't, and you shouldn't.
No.
Because that will lead you into places a lot worse than where you've been before. I think a lot of people generally utilize those drugs as a crutch for dealing with their problems.
Mm-hmm.
That is just my opinion, but there are some people who need the drugs, and there are some people who utilize them as a crutch for, like, I just want to feel better now. I could just pop a pill. I don't have to deal with anything else after that. This is not advised.
Mm-mm. No.
Not advised.
What about
you gotta deal with your problems?
Yeah, like anxiety. That's a big one, right?
Oh, yes.
So people may just go to their general practitioner and say, give them symptoms, and this is what it feels like. Is that a good?
The only people who are winning in this situation are the pharmaceutical companies.
Yeah.
For that.
That's
And just so that we're clear, the pharmaceutical companies do not have a good reputation anywhere in the world at this point. And they don't care, because people are hooked.
Mm-hmm. Mm-hmm.
So I think that a lot of people, like the old ways of dealing with your problems, going to a counselor, working it out, are going away because we have a drug that will dumb you down. Let me ask you a question.
Yeah.
Let's say somebody is feisty, as an example. Let's say your kid is feisty. Why don't you take them to a surgeon and have them lobotomized? You know, when they took the pin, they put it
Oh,
in and put a poke a hole in your brain, and all of a sudden you're calm. You're all calm and
mm,
everything else. How are you? How? Why don't you do that? Because it's a medical intervention that's over the top, right? Well,
yeah.
so is your pill.
Yeah. Yes.
Because that is a chemical lobotomy for a lot of people.
Chemical lobotomy.
For a lot of people, that pill is a chemical lobotomy, and a lot of people generally tend to not understand that when it is that you're taking pills to alleviate your symptoms or whatever else, and you go back to the doctor, and the doctor says, "Oh, these are not working anymore. Let me give you a stronger dose." That not good. How is it
No.
different? How are you different from the guy on the street corner shooting stuff up his arm? No
Exactly.
difference.
Exactly. And think of the chemical. Everybody's body is so different chemical wise inside.
Yes. That's a
And
very
so,
good point.
yeah. And so you're taking this pill that is supposed to help everyone, but your body can react to it in a way is like, I don't like this. I don't like this.
And let's face it, all of these drugs take a toll on your liver.
Yes. Just
So the byproducts of these drugs will take a toll on your liver. Guys,
kidneys,
just
kidneys.
work your problems out in a
Yeah.
clinical setting. Like, just find a counselor and
David and I are counselors.
yes, both Amy and myself are qualified counselors. So get yourself a counselor. And this is not an advocating for the
No.
job of counselor.
No, no,
This is not an advocating. We're not advocating for the job of counselors. What we
no.
are saying to you is that why would you give yourself chemical lobotomies just because you want to avoid or run away from your problems? Because that's what it is. If it is artificially raising your mood,
Yes.
if you cannot raise your mood by yourself and you need a pill to raise your mood, then you are dependent.
Mm-hmm.
I didn't want to use the word that came to my mind, but you are dependent. And so, what we want to say where this is concerned is there are some people that absolutely need the drugs, or else
Yeah.
what's going to happen? You're going to have suicidal ideation and stuff like that
Yeah.
going on. But
Bipolar is a big one. Bipolar is a big one.
bipolar, manic depressives, and so on,
Yeah.
they need the drugs. But if you're just depressed because your cat died, don't pop a pill.
Yeah.
Deal with the grief, go through the stages of grief. If you need to see a counselor, go see a counselor, right? But don't make yourself chemically dependent on something so that you can feel better. Because then when you look at the drug addict down the road and you make a judgment, you gotta look at yourself at the same time.
It's kind of like a relationship with your medication, isn't it?
Oh yeah.
Just like a relationship with anybody else.
hmm
Is
That's
this?
why, honestly, Amy, that's why stuff like opioids and stuff like that,
Mm-hmm.
there's a epidemic like of people just taking that stuff, killing themselves.
Mm-hmm.
Okay? Vicodin,
Mm-hmm.
pain. When you take that, and the pain magically goes away.
Oh, and
The
then
problem is still there, but the pain magically just evaporates.
I know, and I feel for those people that have this chronic pain, because they are so dependent on a relief of some kind.
If you have chronic pain that is affecting your quality of life over a period of time where there is no possibility of fixing it, then you would go low dose first
Mm-hmm.
as opposed to high dose. So the doctors are trying to cut back on the pain medication because they realize that the opioid crisis is growing. And so they've developed something, they have the unintended consequences is that now there's a black market. And whether
Mm-hmm.
there's a black market or a legitimate market, the pharmaceutical company will benefit tremendously because you got to buy it from them.
Mm-hmm. Mm-hmm.
Because there are very few labs in the US and Canada and all over the world that are equipped to create those drugs, right? Safely. Okay.
Mm.
So you want to talk about marijuana because it's legal where I am. You know, when they legalized marijuana in Canada, everybody was like, this is such a good thing. It's not like alcohol. It's something wonderful. It's a magical plant. It is a magical plant, absolutely. Okay. If you're popping gummies every day, not so much.
No.
The only magic that's happening is your life is disappearing like poof. Okay.
Yeah. You're
So,
going out of your own reality, right? You're escaping.
correct.
You're escaping.
Escaping. Escaping. How
Yeah.
many? Honestly, Amy, like we have seen, because Amy and I have been in different communities. We have seen people using ayahuasca as an example, as psychotherapy.
Mhm.
Okay. Let's say you've had 40 years of a messed up life. Taking ayahuasca is a bad idea. Why? Because what that plant does, it gives you about, what, 20 years of psychotherapy in one night. Do you think your mind can handle that?
No, not in one night.
Every trauma, every last part of your life which was dysfunctional becomes
Come to the surface, yeah?
correct.
Yeah, do you want to deal with that? Wow. Wow.
I honestly think that a lot of people generally decide that they're going to go down the route of having ayahuasca, right? Anything that deals with your trauma that brings it up to a large degree and has you in a trance for an entire night, hallucinating
Hmm.
about your past and your life, it's probably not a good idea. It will send you crazy. A lot of people have gone crazy using ayahuasca. A lot of people have gone crazy. I'll say this again, using ayahuasca. So for those of you who are going on spiritual journeys and so on, utilizing chemicals, guys, if you want to elevate your spirit and you elevate your consciousness and so on, please don't use chemicals to do it.
Mm-mm. Can I ask you a question about that?
Sure.
I was just thinking, so let's say, oh, well, I had a good experience with ayahuasca. Um, do the effects stay in your body? How long do the effects stay in your body? Like 6 months down the road, 2 years? Do we even know that science behind it? Do we know the science behind it?
The science behind ayahuasca?
Yeah.
No, we don't.
No, we don't know the science
But
behind it.
we do know that it makes you high as hell
Yeah.
and makes you face your problems and everything that you're trying to run away from, like in a line, just waiting to jump all over you because
Yeah.
you opened the door, right? So if you think about ayahuasca, if you think about your programs and all your desires, motivations, and so on as demons, well, you just open Pandora's box by
Hmm.
taking ayahuasca, and they're going to come looking for you, right? So there's a way of going about spiritual transcendence without having to take chemicals.
Okay, so tell us, what do you think after all of these things we've talked about, people to see?
Mhm,
What is one thing you can tell people
mhm.
that a little takeaway for today, mm, something they can do for themselves? No drugs, nothing, just something very simple.
Learn to meditate. That's number one, because then you become your own psychotherapist, counselor, and shrink, or whatever you want to call
Hmm.
yourself, right? Learn to meditate, right? There are mindfulness techniques such as meditation, which are very beneficial for you. They're also a lot cheaper because meditation is just cheap. You can just like do it anywhere, that kind of thing. I think that if you are experiencing distress, however, then you find yourself a professional, a counselor. If you are experiencing the kind of distress that requires medication, then you absolutely should see a psychiatrist. That would be
Yeah.
my takeaway.
Yeah. Yeah. And I would add to that, just journaling your day, and all the things that are in here will just come out on the paper if you don't think about it. At
Correct.
least that's what it does for me. It's like, oh, I didn't even realize that I wrote that. Wow, I'm going to look into that, because that obviously is a belief system of mine or a pattern that I do that upsets somebody, or, that. And also just having someone you can talk to that you trust, if you're really going through a hard time, know that one person that you can dial 911 for.
Correct. Well, Amy,
Yeah.
honestly I think that a lot of people are wondering in terms of how would you get a hold of a counselor, like Amy as an example. Tell these people to get a hold of you.
Yes. Okay, you can reach me at pinkmoonlodgepodcast@gmail.com. And you could join our community. David and I have a UCM community at community.universalcitizentv.com. So come join us there.
And you guys can find me at info@unifiedhealthsystems.com, where you can schedule DNA screening testing. It doesn't matter if you're an international client. I can send you test kits, and you guys can get an analysis of what your predispositions are, etc. Right? Thank you guys for watching, and we'll see you in the next one.
Thank you. Bye.